Assalamu alaikum, dear believers. My name is Lionel Allen Jr., and on behalf of the Talem Committee of Masjid Al-Taqwa, Dr. Aisha El Amin, Dr. Gloria Bashir, Sister Rashida Fitzpatrick, I want to welcome you to today's Talem. We're very excited today to deal with a really important topic in our community. Is the members of our community continue, inshallah, to advance in age, and those of us who are supporting our loved ones who are also maybe advancing in age. This topic of navigating the Medicare Labyrinth is of utmost importance. And today we have with us Brother Ameer Muhammad, who is a longtime healthcare advisor and broker, who's going to share his expertise and his wisdom with us. But before we get started, I want to make sure that we acknowledge our brothers and sisters from the Ephraim Bahar Cultural Center. So excited to have you all with us today. The more, the merrier. We're also recording today's Talem session. So for those who intended to be with us, but for whatever reason are unable to be with us, please let them know that this session is going to be recorded and that they will have access to this very important information via YouTube. So, we don't often hear great things happening on YouTube, but this is one of those instances where something of benefit, inshallah, is going to be provided via YouTube. I also, for those who have access to, who are joining us from a computer and have access to Google Docs, I've also placed in the chat a folder that contains some resources that Brother Ameer have already provided for us. A pamphlet that includes very important information, as well as a cover page that Brother Ameer is going to be walking us through. So without further ado, Brother Ameer, assalamu alaikum, my brother. Thank you for being here with us. We're excited to have you, and welcome to today's Talem.
Wa alaikum assalam. And in the name of Allah, the merciful benefactor, the merciful redeemer, I just, as I stated to you earlier, Brother Lionel, I want Allah to guide my mind, to guide my tongue to do the right thing here, and to give as much information that I possibly can. And may Allah bless me to do that for His pleasure and the benefit of us all. Ameen.
Ameen. Ameen.
Ready when you are, sir.
Yeah, so, why don't we start by talking a little bit about you? Would love to hear about your background. I know that you have a really rich history in this community, so would love to hear about that for those who are joining us who don't know you. But I'm also interested and fascinated about how you got into this line of work. It's such a specific area of focus. So if you could talk to us a little bit about your navigation to this space, that would be wonderful.
Okay, I'm going to be brief because, I've been, since I was brought into this world, a part of the Muslim community, the Muslim Ummah in this country, from the Nation of Islam to the leadership of Imam Muhammad to this day. So I did attend the University of Islam. I graduated there in 1975, and I went to college at a school called Aerospace Institute and got a bachelor's degree in business. It was actually called Aviation Administration, but it contained all of the components needed for business. But I was interested in mechanics and aircraft, so I said, well, why not, learn, have fun while I'm learning, learn about jet propulsion and all these sorts of things. And so I did that. And skipping over a lot of stuff, in 1984, having worked consistently and having had my first job, at age 11, and actually being so grateful for that experience, because it allowed me to understand the benefit of work and the benefit of helping people and the benefit of having my own dollars. And that was given me by my grandfather, the Honorable Elijah Muhammad. Said, son, I can't give you a job at your supermarket, but you can work at my store. I said, yes, sir. And I learned a ton working down there under the beloved brother, Saeed Muhammad. May Allah bless him with the best possible outcome. I love my dear brother so much because he was very much a part of my life and my upbringing, just as well as my father, my uncles, my mom, grandparents, and so forth and so on. But in any case, getting back on track, let me get back to my notes. I entered this business out of necessity. I was unemployed in 1984. And I went to then what was known as the job service. And, you know, going there several times, man, it's a bunch of stuff I didn't want to do. I'm like, man, I don't want to do that. Man, I don't want to do that. Man, they don't make enough money. What's $2.65 an hour? What's $3? No, I can't do that. I mean, I got, you know, I got two children. At that time, I had two children and one on the way. I'm like, no, man, I can't do that. No, so I need some money. So the lady kept looking. She said, well, why don't you know, are you willing to switch your focus? I said, ma'am, short of doing something illegal or something that I just can't do, you know, I do what I need to do. She says, well, take a look at this. It pays you $300 a week. In my mind, in 1984, in the middle of summer, my eyeballs got this big. I said, $300 a week? I take care of some business there. She said, well, it's in the life insurance business. And I said, oh, I don't know nothing about that. She said, don't worry, they'll train you. So they trained me all right, brother. They put me in the Robert Taylor homes from 44th Street to 51st Street. And that was my clientele. So I learned how to navigate the business. I learned how to collect premiums from these people, be it, you know, most of it was cash. They didn't have checking accounts. So I'm walking around in the building after I collect my premiums from my clients. I have to get past the young folks that, you know, represented themselves as the gangsters in the building and such. And I had a couple of run-ins with that. And that was an interesting subject I can talk about another time, but Allah blessed me through that. I went through that for about 13 months and I moved on from that into other parts of the business. So I worked life insurance business, got started, got my license in January of 1985. And only had 1 year in there where I didn't work. I said, well, let me try something else because, you know, it was just like, let me see what else I can do. So for 1 year, I didn't have my license. I think that was 2011, but I got my license back in 2012. And at that point, I wanted to pivot into something else that was more beneficial than just life and health insurance. And so I've been exposed to the healthcare side of it for a while, but I just didn't engage it. So in that year, I decided to engage it full on to learn what Medicare was all about. And you know, and that means delving into what A, B, C, and D is, how that affects the individual, and how to give clients the best outcome. Also, what I was brought into the business in 2012, but before that, I was taking care of Sister Lottie Raya Muhammad. I was her, basically her caregiver. May Allah bless her with mercy in paradise, until she made a transition in 2017. So from approximately 1990 was when I basically became a caregiver, because mom was in a situation at that time where her income stopped. And I was intending on emancipating, getting my own joint, you know, and moving out and buying me a home and all this good stuff. And I said, mommy ain't got no money. She got to take care of this 9-room house. So I had to become a caregiver. So I took care of mom, made sure she stayed in her home, and she was able to use her $200 and whatever dollars it was a month just on herself. You know, she loved home shopping clubs, so that's what mommy did with her money. But anyway, let's move forward.
Yes, sir. Yes, sir. Thank you for that story.
But from that, taking care of mom, I learned what Medicare was.
Okay.
I had to do it head on because mom had issues. You know, she at the time had a Humana plan back in the 90s. And I'm like, you know, I had to find out what it was because mom was having issues. And I had to understand what going to the center there on 79th Street, the boy, 64 years and 11 months, it's hitting me. Basically the center that helps the elderly.
Okay.
Department of Aging, thank you. Thank you, my Lord. Department of Aging. And so I went there to help mommy with these things, and that's when I learned, like, man, this thing is multi-layered. It's a lot of stuff for a senior to comprehend. And so I had to really just, you know, stand up and do this for my mother because, you know, she didn't know what to do. And, you know, I just had to step in and make it a part of, you know, make it better for her. You know, besides taking her to the doctor and making sure her appointments and all that. So by being her caregiver, it made me understand what this business was all about. And then I'm like, I'm living this business with my mom and I'm learning all these things that I have to learn for her. Why can't I get certified and ready to sell and do this for everybody that I can, for many people that I can. So that's where that happened.
Gotcha. So let me follow up. Can you tell me exactly what a healthcare advisor and a broker does? It sounds like you learned a lot of this through sort of baptism by fire, like you learned it out of necessity.
Yes,
And you
sir.
were able to monetize what you learned from helping your mother and now use that knowledge and wisdom to help others. But can you tell us specifically what it is that you do as a healthcare advisor and broker?
Well, basically, any healthcare advisor and broker that doesn't put the client first don't need to be in this business, because you have to be able to assess the needs of each individual. Each individual has their own set of circumstances. Nobody's circumstance is exactly the same. The other thing is you want to, excuse me, put my glasses back on so I can see what I'm doing. You want to be able to assess that individual's physician, specialist, the medications they may be taking, the networks that their doctors are in, and you want to place them in a situation where it's comfortable. You don't want to come in and say, hey, I got this one funnel over here, and if you change doctors and if you change this medication to this funnel is going to work out for you. No, that's not how it should go. So what a properly situated a healthcare advisor would do is to situate themselves with several contracts. That means they have, as I do, I have 7 contracts from the major carriers in this space, in this part. I'm also licensed in other parts of the country, but for here in Illinois and Cook County and DuPage and so forth, and Kankakee and so forth, I have 7 contracts. And with those 7 contracts, I'm able to sit with a client, say, okay, tell me your doctors, tell me your specialists, and if you're on medications, give me a list of your medications. I take that information and I locate their doctors and which plans that they are affiliated with and which plans that they can serve. And I take their medications and run it through the several formularies of the 7 contracts I have to see which one is most beneficial. Now, that in a nutshell answers your question. And that's what a good Medicare advisor should do. You put the individual first, you put their needs first, you match them up with a proper plan. And that could be a Medicare supplement plan and a drug plan, or it can be a Medicare Advantage plan, because there's really only 2 ways you can go in this scenario. You're going to either have a supplement and a drug plan that you pay out of pocket for up front, or you're going to have a Medicare Advantage plan where you pay as you go. You pay with copays.
Mm-hmm, mm-hmm.
Now, the most inefficient way to go is to just have Medicare Part A and Part B. And that is because that puts you in a situation where you are 20% out of pocket to infinity. I mean, you do not want to have $100,000 bill for a surgery and you're going to get billed for $20,000. Mm-hmm. Where does it come from?
Right.
Most of us don't have that kind of money just sitting around.
Right. Assalamu alaikum, dear believers. We're here with Brother Ameer Muhammad, who is walking us through the very complex web of Medicare. We want you to feel comfortable putting your questions into the chat. I'll pose those questions throughout the time that we have with Brother Ameer. And if you want to take yourself off mute towards the end of our time together, feel free to do so and pose your questions then. Can you tell us exactly what Medicare is and how it works? Because I don't even know if people have a basic understanding, at least I certainly don't, of what Medicare is and how it works and how it's of benefit to folks who qualify for it.
Okay. For those that are on Medicare, you know, starting whether you are beginning as a part of being age 65 or older, or you're on Medicare from disability, you receive this book. Okay? Mm-hmm. And in this book, you have 4 parts of Medicare. You have Part A, which covers in-hospital, hospice, and certain other things. Let me look at the notes that I had that we have, brother Lionel. That should be in the folder.
Yes, I just you want me to put the cover page or the booklet in the folder?
Well, you can put the cover page up for now because I'm gonna go over what those deductibles are, and then that'll help folks understand the need to have something to go along with it.
Got it. I'm doing that now, inshallah. Here we go. Share my screen out for the believers to be able to see.
Now, Part A is hospital coverage. That covers skilled nursing, hospice care, home health. Part B services are for doctors and other healthcare providers. It covers outpatient health, durable medical equipment, and many preventive services like screening, shots, and vaccines. Part D, which is drug coverage, and Part C is called Medicare Advantage. Okay. Now here on this screen, I put on, and what the brother's showing now. If you scroll back to the top, Brother Lionel.
Yep.
These are the deductibles that you'll face and the cost that you'll face going through original Medicare. If you have Medicare and you enter the hospital, first day in the hospital, you're going to incur a deductible of $1,600. That means that you're going to pay the first $1,600 of everything that happens with that hospital stay. You also have to pay a Part B deductible once a year of $226. And of course, you have Part B premium, which for most of us is $164.90 a month. And you also have, if you're going to have some protection with that original Medicare, you want to purchase a drug plan, which is an average monthly premium of $30, or you can purchase a Medicare supplement, which will cover that 20%. Under Plan G, that's approximately $130 a month, okay? Now, the other way you can go, scroll down, my dear brother, is Medicare Part C. Medicare Part C includes all of the benefits of A and B and usually include Part D. These are network-based plans offered by private insurance companies. They may provide lower out-of-pocket costs than original Medicare. Most plans offer extra benefits than original Medicare doesn't, like vision, dental, hearing, and gym memberships and that sort of thing. And Brother Lionel, we can then go to the first page, this next page of that handout.
Okay, got it. All right, I'm sharing my screen again here. Is this the page you're talking about?
Where it says, what is Medicare at the top of that page? Yes, sir.
Okay.
Right, and that is, again, Medicare is health insurance for people 65 or older, or certain people under 65 with disabilities. I mentioned that. People with any end-stage renal disease or permanent kidney failure requiring dialysis or a kidney transplant. I did mention to you those parts A, B, D, and C, because in this, scroll down, Brother Lionel. Okay, it goes through A, B, C, and D, and then it goes to Part C by itself. Now here, scroll up, Brother Lane, just a little bit. Brother Lionel, I'm sorry. Yes. No, sir, to the top of the second page. Yes, sir. These are your options. So these are the two ways you can go with your Medicare options. You can go with original Medicare, like I stated, and get and purchase. Scroll up a little bit, brother Lionel.
How's that?
Yes, sir. You can go with original Medicare, and you can purchase a Medigap plan, which is called a Medicare supplement, to take care of that 20% out of pocket. But you also have to purchase a drug plan, because Medicare requires you, when you're first eligible for Medicare, is to get a Part D prescription drug plan and get your Part B, unless you have creditable coverage. What that means is, if you are still working and you maintain coverage at least as good as Medicare, then you do not have to take Part B until that coverage ends. And also you can delay your Part D as well. But if you do not have credible coverage when you first eligible and you don't get it, you don't get Part B and you don't take the drug plan, Medicare has in place a way to penalize beneficiaries. Just want to make you aware of that. And so again, just scroll up a little bit if you can get past that, get to the part where okay, there we go. And basically this shows that you have Part A, Part D, a drug plan, and a supplement. Over here, your Part A and your B is included in the Medicare Advantage plan. So is your drug plan. You get extra benefits and lower out-of-pocket costs. So it just depends on the individual which way they should go. And again, that is a very varying situation. I have clients on both sides of the scale. Those that have Medicare Advantage plans and those that have Medicare supplements. Okay. I hope I was clear on that. I mean, this is a convoluted subject. If I've gone too quickly, we'll answer questions.
I have a quick follow-up. So it looks from this that when we talk about the parts of Medicare, so to be very clear, Part A is about the coverage you have or receive when you are in the hospital, and Part B is the sort of broader health medical insurance or wellness insurance that you're able to get, and then Part C is another part of that sort of supplements Part A and B. Is that correct? Is that the right way to explain that?
Well, Part A hospital insurance is inpatient only.
Okay.
Part B covers basically service from doctors and other healthcare providers. That's inpatient and outpatient, because without Part B, you don't get any service in the hospital. You just get a room and nothing else. And so you really can't get admitted to the hospital with just Part A. You have to have Part B to get admitted, because you have to pay for the help to be there. You got to pay for the doctors and nurses and support staff to be there. So you got to have Part B. Medicare Part C was basically put into place to provide an affordable alternative. Now, here's the situation, and I'll tell you how it came about really quick. Insurance companies came up with the bright idea and says, with fee-for-service Medicare, there really are no checks and balances to help control costs. And they said, okay, then give us a solution. So the insurance company said, well, we're going to help you save money if you would allow us to, you give us that same pool of money to take care of these folks, and we'll come up with health plans that give them everything that you give, but we're going to add other benefits to it. Well, the government basically in long and short said, sure, why not do that? And these plans do effectively take better care of individuals by promoting health, and in some cases paying patients to do things that they should do for themselves. They give you an encouragement, like if you need to have an exam, they'll give you a gift card to take that exam, or to have that procedure done. For instance, like cancer screening and things of that sort. Some of these Part C plans will give you gift cards for doing those things. So in that way, they do serve a good purpose. So that's the difference between the two. Okay. Fee-for-service Medicare will simply just, present the bill, get the bill paid. Medicare Part C, those insurance companies have pledged to save Medicare money and to keep the population more healthy. And so therefore, that's their mission. And they do so without the upfront cost. Whereas with a supplement and a drug plan, you have to pay upfront. With a Medicare Advantage plan, you pay as you go.
Okay, got it. That Medicare Advantage or Part C is really a bundled plan of Part A, B, and D, which
absolutely, yes, sir, it is
part of the original Medicare. Got it. Okay, I'm a little bit smarter today because of you, dear brother. Our Assalamu alaikum, brothers and sisters. Again, we are with our dear brother Ameer Muhammad. If you have questions about Medicare, there is no question that's too silly. Please feel free to put those questions in the chat or take yourself off mute and pose your question. All right, so you had this real world experience helping your mom sort of navigate this very complex situation. What advice would you give for others who are also caretakers of parents, uncles, aunties, grandparents, etc.? What advice would you have for us who are in a similar situation that you were in terms of navigating this really complex web of healthcare and wellness and such?
Keep them at home as long as you possibly can, because seniors love their home environment. The one thing that broke my mother's heart is that she had to leave her home. And it wasn't because of anything except that she had dementia and Alzheimer's. And, mom was brilliant enough to escape the house and be on 79th Street, standing on the corner talking to the local folk. I'm driving home from work and there's my mother standing on the corner. So that didn't work out well. And there was, along with that dementia, mom developed other things where she would forget her medications and that sort of thing. So that became an issue. And I still had to work, but I went to her home early in the morning and then right after work and made sure she had her meals and all of that. But the one thing that I wish I could have done is kept her in her residence until she made a transition, but I couldn't do that because of her condition. If you can keep a senior in their space as long as you possibly can, that is best for them. Because going into a facility, the quality of care there is fair at best. I'm just going to be honest with you. And you got to keep an eye on your family member when they go into these facilities. If you do not pay them attention, they won't pay them attention. They will just, if you don't show up on a regular basis, your parent or your loved one's going to get neglected because you don't show up. Well, thank Allah I showed up often enough, and I insisted on my mother's care to the point I made the director of nursing cry. So I'm sorry for her tears, but this is my mother. You're going to take care of her. Simple as that. So my stress is keep them in their home and in their place as long as possible, because that is where they're most comfortable. That is where their strength is, their heart is. When you put them in that situation, disorientation, the spirit falls, and all these other things. So keep them in place as long as you can, and be attentive as often as you can. If you can see them daily, see them daily, and make sure that their needs are covered. Yeah. That's what I can share with you.
Yeah. So we have a question from our audience. The question is, does Medicare cover in-home care for seniors?
The answer is yes, if the physician deems it necessary. Your physician has to deem it a necessity in order for that to happen and to be paid for with Medicare dollars. It's not something that you can just initiate and it happens automatically, because that is covered, it is covered under Part A and B, but it has to be something that's initiated through need-based, and it has to be initiated by by the physician.
Okay, got it. You've given us some examples of what to do. Sometimes the message is made clearer by the non-examples of what not to do. So can you give us some things that we should absolutely not do when we're thinking about either navigating the Medicare labyrinth, or when it comes to taking care of our seniors? What are some things that we should absolutely avoid? I mean, you gave us one thing, which is don't put your loved ones in a facility too early. Keep them at home for as long as you can. But are there other things that we should also avoid, potholes that we should try to avoid? Because it's inevitable that we're going to be in a situation where we're taking care of our elderly loved ones.
Well, the main one is fear. Fear keeps you from investigating and finding truth. Lack of fear is the opposite of faith. Have faith and reach out if you have a question. Don't just shut down and say, oh, I don't need this, I'm not going to do this. That's an unfortunate thing, because those penalties I spoke of pile up. And if you don't exercise in proper time, and health is going to change. There's some of us that are blessed to come here and leave here and not have to ever enter a hospital. That's not everybody. But some of us are going to have change in our health, and some of us are going to have need for medications down the line. So my saying is this: when you have a question, don't be afraid to ask. You can always reach out to myself. You can always reach out to Medicare, Social Security, and ask a question. There's nothing go wrong with doing that. Ask questions. I mean, even ask questions from your peers and from your relatives and so forth. Just reach out and get your questions answered. And I'm open to answering as many questions as I can.
Yeah, no, that's great. Thank you. Please.
We have a question.
We do have a question. Okay, go ahead, dear brother. Assalamu alaikum.
Alaikum salam.
Wa alaikum assalam, Dr. Lionel and Brother Ameer. The question is, will the financial stability of the Medicare system wind up like that, which is going on with Social Security? Are they in the same boat in terms of financial stability?
Well, sir, from my individual point of view, all of it is in peril because Congress continues to borrow money from the Social Security and the Medicare fund without repaying the money. Medicare and Social Security are the two largest funds available, and Congress accesses that fund and have accessed that fund since its inception dozens of times and never put a penny back. Okay, so that is why you have all of these predictions of the end of Social Security and the Medicare. It's not by accident, it's by the act of Congress. And who controls Congress? Your 1%ers, your wealthy people. They do not, as Michael Jackson said, they don't care about us. And so therefore they continue to borrow from those two funds to basically crash them. They do not want to take care of the people. So, brother, those two systems are in peril, but the people need to wake up and let the government know this is our money and this is what we want done with it, and stop serving the 1% and serve the 99 or the 100% of the people in this country.
Mm-hmm.
Thank you, brother.
Thank you for your question, Ma'am Tamir. Other questions from the audience? Okay, don't be bashful. Put them in the chat or take yourself off mute.
Gotta speak up. Yes, sir.
Assalamu alaikum.
Walaikum assalam. Thank you very much. This question for the brother Ameer. I have a question concerning Part B of Medicare. If a person has Blue Cross as a primary insurance, and they also have Part A and B of Medicare, and the Blue Cross is paying for the outpatient, outpatient therapy, and left with a copay, should Part B of Medicare pick up that copay?
No, sir, because when you enroll for a health plan like a Medicare Advantage plan, as you mentioned the name Blue Cross, when you enroll for that type of plan, sir, Medicare gives the dollars to that plan to take care of you. And it covers all the benefits of Part A and B. And copay is your part of the cost of utilizing that plan. When you have a Medicare Advantage plan, copays are a necessity.
Yeah.
Only way they become non-necessity is if you happen to be Medicare and Medicaid eligible. When you become Medicare and Medicaid eligible, the state will pick up where the federal government leaves off and therefore can cover those things. But if you are not Medicare eligible, we all have to pay those copays.
So only if you're Medicaid as well as Medicare.
Yes, sir. And there are qualifiers economically and health for Medicaid. In other words, you can't, they are specifically for a set of individuals that need Medicaid. And I've stressed that because there are a lot of people that are on Medicaid that don't need it, and they're killing the fund for those that do need it.
Well, yes, I experienced both actually. So yeah, that answers my question. Thank you.
Yes, sir.
I got a question also. As I get closer to retirement, I have been advised that make sure I get Part A, B, C, and D.
Okay, so
Get all the parts.
Brother Imam, aren't we about the same age?
I'm 63. I think
Okay,
so.
well, you've got a year and a half to go. Well, Brother Imam, what you do is give your dear brother a call. I'll share with you what you can do, but here's the answer to answer your question. When you approach age 64, you are given a 7-month window to get situated with Medicare. 3 months before your birth month, and 3 months after. My advice is to get situated in those first 3 months because you'll be all set for your birth month. And I'm giving you the advice that I've taken for myself. Praise be to Allah, I'm going to have my Medicare coverage starting September 1st. I started my process when I was first eligible, June 1st. So reached out to Social Security that first month. Social Security did all the jiving and stuff they need over the phone, all of the, what I call, I don't really care for, but you have to do it. They have to, know all your business. So you got to divulge all your business. And they know everything. So when they're talking to me over the phone, I can hear them in the background, just basically, yeah, he's not lying. Yeah, he's telling the truth. Yeah, he's telling the truth. So you go through that process, sir, and get set up with Social Security first. Then once you get set up with Social Security, Medicare is going to send you a letter stating that your Medicare Part A and B benefits are going to start the first day of your birthday month. And then a few weeks later from that, you're going to receive your red, white, and blue card in this little red, white, and blue booklet, kind of giving you a Medicare primer. And in that window, in that same window, Brother Imam, you want to reach out to your brother here so that I can share with you which way do you want to go? Do you want to protect your out-of-pocket costs with a supplement and a drug plan, where a Medicare supplement, again, covers that 20% of out-of-pocket costs with paying a Part B deductible, and you have to get a separate drug plan because when you're first eligible, you have to pick up a drug plan, whether you're on medications or not. So my advice to you is when you get to that when you get just before that point, that 7-month window, give me a call and I'll walk you through again what you need to get done.
Okay, now do that process if I do that process cover me and my wife, or she have to do that process herself too?
It is an individual process. Everyone that has an individual Social Security number is an individual to Social Security. There's no group plan with Social Security. Every individual has their own plan.
Even though I'm the main insurance provider, she still have to do the process too.
Absolutely. When she becomes Medicare age, are you both the same age?
About a year or so difference.
So are you right now, as the breadwinner, are you providing her health coverage right now?
Yes.
Okay. So there may be a window in there. And again, we need to have a discussion directly because I need to have more information. There is a window in there where you'll want to be sure that your wife still have coverage, and I can share with you how to get that done.
Okay.
Thanks for your question, Ma'am Omar. Ma'am Tariq, I saw your hand raised a few minutes ago. Unmute yourself and join the conversation, if you so please. Ma'am Tariq, are you still?
I have a comment.
Well,
I see you connecting to audio.
assalamu alaikum.
Oh, well, I see Ma'am Tariq is back.
Yeah, assalamu alaikum. So, my question, I don't know if it was actually asked in some shape or form earlier. When you have it's Medicaid, right? Or when you have this, does it work? Can it work as a supplement to another insurance, or is this the only insurance that you would have?
Please state your question one more time so I understand it, sir.
So if I'm carrying Medicaid, does this would this be as a supplement to another insurance, or could another insurance supplement it, or is it a standalone by itself?
You speaking of Medicaid or Medicare, sir?
Medicare, I'm sorry, Medicare.
So Medicare, again, is available to those that are either disabled or 65 or older. So when you reach age 65, your group coverage is going to end unless you continue working. If you continue working and maintain that coverage, then you can delay getting Part B and Part D until you actually lose that creditable coverage. But when you turn 65, Medicare does become the primary source of healthcare.
Okay, thank you.
Yes, sir.
We have another question that's been placed in the chat. What services does the Department of Aging provide specifically? Do they help to prepare your home to accommodate a senior with things like handrails and hand grips?
Those things, they can assist you with guidance on getting those things. That's what they're basically as a resource to show you and tell you what you can, how to get those things. They don't directly have those resources under their envelope, but under their care. But and again, this is my experience, and mostly this is my experience is from years back. But when I used the Department of Aging for my mom, they basically directed me on, hey, we have Meals on Wheels. We have people that can come in the home and sit with your mom while you're at work. We have, does your mom need walkers or wheelchairs? And I said, no, mom is walking just fine. So they direct you, the Department of Aging. This is with the Chicago, Illinois, I'm saying this too. I did not have experience with the State Department of Aging because my mom lived in Chicago. So when I went to them, they were able to give me resources to help mom. And they would help me initiate those resources.
Got it. Thank you very much.
Yes, sir.
Other questions?
Assalamu
Walaikum Bashir.
Yeah, I came on late, Ameer, a little late. Appreciate the information that you've given, very good. One area too, I know you mentioned, I don't know what Medicare, Medicaid, or someone had a question about whether coverage for in-home. I know I'm currently receiving
coverage, and I know, I think it is anyway, it's a part of Medicare benefit to have someone come in and, like you said, clean the house, cook meals for you, that type of thing. And they will allow a family member to do that and pay them. So that is a benefit that is available, and I'm quite sure you have to be covered by Medicare to receive that benefit. Also, I have a question about coverage for eye and dental care and other specialty cares that may be provided. And, you know, to the situation you were talking about, your mother and nursing homes. Of course, the Imam had advised us that we should do that, something that we should do in our community. I know the Jewish community and other religious communities have nursing facilities, and those facilities are designed to care for people who you know, in those communities that, you know, they have, just like we have dietary restrictions, and in those areas too, you have people with the same cultural and religious background. So that's something that we should be focusing on too in that area. But what about eye and dental care and other specialty services that may be provided through Medicare or Medicaid?
Well, Brother Assad, thank you for the question. Medicare directly only covers eye care in the event of glaucoma or loss of vision for diabetic situations. In other words, Medicare has very limited benefits for vision. There is no benefit for dental. There's no benefit for hearing with original Medicare A and B. You can capture those benefits by either purchasing them on your own. If you have Medicare A and B and you want to have dental, vision, and hearing, insurance companies will provide you a means to get those benefits on your own out of pocket. And if you want to cover the 20%, you can do so with a Medicare supplement and a drug plan. If you want to have those benefits covered on a less limited basis, you get a Medicare Advantage plan. And the majority of Medicare Advantage plan in our area does cover dental, vision, and hearing benefits.
Okay. One other thing I'd like to comment on too, when you were talking about Medicare and the financing situation with that, where Congress is borrowing those monies in relationship to Social Security. And what I'd like to make us aware of, in this participatory government, this democracy we have a responsibility to make sure that these benefits and these services are put into place, that they are administered equally and justice. And I know you mentioned about how the big government or big business controls these things too. But we have to be participatory. And when we know these situations exist in a democratic form of government, we have to be a part of that solution and be active. And when people like yourself come make us aware of those things, we can't sit on our hands and do nothing.
Alhamdulillah, brother. Thank you.
Thank you for that word, Brother Bashir. Other questions? Feel free to place your questions in the chat or raise your hand and I can acknowledge you at that time. We have a question from the Bahar Center. Please join the conversation. Assalamu alaikum.
Assalamu alaikum.
Wa alaikum assalam.
Brother Ameer, I'd like to ask you a question. When you're seeing a specialist, you have Medicare Advantage plans and you're seeing specialists, you pay your copay after the doctor billed Medicare, are you responsible for whatever the insurance doesn't pay?
No,
Although-
ma'am, you are, no, and let me share this with you, sister. The answer to that is no, but you are responsible for your copay amount under that contracted plan. So, and also, if you are in an HMO type of plan, be certain to have a referral from your primary doctor to that specialist. Because if you do not with an HMO plan, neither Medicare nor the plan will pay for that procedure. In other words, you just can't walk into a specialist and say, hi, I've got this health insurance card that's a Medicare Part C plan, and I want to see you. Well, that doctor's not going to turn you down. They're just simply going to bill you directly. Or they're going to attempt to bill Medicare in the plan, and the plan is going to turn them down, and Medicare is going to turn them down because you don't have a referral. But if you have a same coverage with a PPO plan allows you to go in or out of network. You will have the coverage, but your copay will be higher than it would be in an HMO plan. I hope I have, see, Medicare is complex, and see, that's part of complexity. I hope I haven't confused you, but basically you have to pay your copay and you have to have a referral with an HMO.
Okay, you pay your copay, but then the insurance pay, let's say they leave $100 that they didn't pay. Can that doctor's office bill you for that $100 even though you paid your copay?
Yes.
No, ma'am. Again, let's say that your specialist copay is, let's say for argument purposes, $40.
Okay.
That is what, for that particular contracted plan, if it is a Medicare Advantage plan, you are only responsible for that copay. Okay? Anything else the plan has to pay for.
Okay.
And if you receive a bill, you should do what is called a Lord have mercy, I always forget this. Appeal. If you get a bill from the plan, appeal that bill if it's more than $40 or more than your copay. Appeal it right away and say, why are you billing this to me? And again, if they come back again and say, well, you owe this, then you say, no, I'm going to file a complaint and a grievance. And when you file a grievance, that not only involves the plan, that also involves Medicare. And then Medicare has a look at it. So don't just willy-nilly pay a bill that's more than your copay. You are responsible for your copay for that specialist and nothing more when you have a Part C plan.
Thank you.
Yes, ma'am.
Dr. Gloria, I see that you've raised your hand. Please join the conversation.
Yes, assalamu alaikum. I've heard, I know that there's a big debate between straight Medicare and Medicare Advantage or Part C. And, you know, I have personally heard some things that were not so favorable about Medicare Advantage. I have a dear friend whose sister had cancer and Medicare Advantage would not cover her chemo. I've heard other stories like that as well from other individuals. And if one has multiple, you know, if they have an area of you know, a condition that requires multiple medical visits, and then, you know, what I've heard at least is that Medicare Advantage may not be the appropriate plan because you'll be hit with copays with every visit. And that could be quite expensive, particularly if you're seeing specialists. Any thoughts?
Yes, ma'am. Number one, if an individual has cancer, they should have a Medicare supplement plan. Okay, and I'm saying that because Medicare does cover necessary chemotherapy treatments. So they would be better served, and I'm saying this in the most general of terms, because a supplement plan you have to pay for monthly. And for an individual starting out at age 65, that's about $130 a month. And on top of that, you have to have a drug plan. Well, maybe that's not an affordable option for everyone. But if you have a situation of cancer, original Medicare A and B is the best answer because it doesn't go through the process of pre-authorization. Pre-authorization is the methodology that Part C plans use to control cost. And remember, I just mentioned appeals and grievances. if that individual has a procedure being denied and it is a legit procedure that was ordered by their physician, through a Medicare Advantage plan, the physician controls the flow. If that physician deems that procedure necessary and is covered by Medicare, the plan has to pay it. Sometimes you have to force these plans because they get the pot of money and they want to control it to their benefit. And they play upon the ignorance of the majority of the population. Exercise your appeal rights to appeal those charges. And if they reject your appeal, file a grievance, and again, elevate that, and that grievance goes to Medicare. And so if you have someone on a Medicare Advantage plan, you need to file appeals and grievances if they are denying those treatments, but they have to be directed by their primary care physician through that Medicare Advantage plan in order for those costs to be covered. If they're doing this on their own outside of network, that's a problem, and you may be responsible for all of the costs.
Ameer,
Yes.
let me ask you, and you may have covered this. I know some.
Sir, did that answer your question?
Oh, yes, it answered my question. I think that as I was saying, from information that I've received and from friends and such, that that in many cases, and I agree with you that if you've got a particular condition, straight Medicare is absolutely, I think, your best option.
If you can afford it.
Yeah, I mean, obviously, if you can afford it. It's at least information that I've received. A lot of healthcare systems, a lot of doctors are really being enticed to get patients to sign up for Medicare Advantage because it's another way of controlling costs, but that's not always in your best interest.
Yes, ma'am, and that's why I'm stressing to every one of in my book of business, I send out a newsletter and I'm reminding them of the appeals and the grievance process because of my clients. I'll give you an example. One gentleman had a procedure with his right foot, a situation with his right foot, where it was a nerve situation. It was a nerve and a blood vessel situation that was causing his foot to swell. And if he hadn't got the attention to get it done in time enough, his physician was saying, brother, if you don't get this done in the next 14 days, we're going to have to amputate your foot. And he said, I'm not having that. Well, I'm not going to say the name of the carrier, but I'm sorry I did it again. Sorry, forgive me. The carrier declined the procedure. And this was my client. I said, brother, you go to your doctor and tell your doctor to file an appeal and tell your doctor to explain to the plan that this is a necessity of high importance. He did that. And my client also filed the appeal. 2 days later, he was scheduled for the procedure. So I'm saying, my sister, it's not that Medicare Advantage plans are awful. You have to know what to do. If you sit back and let it happen, shame on you. So I'm saying you got to exercise the appeal and the grievance process with these carriers because their mission is to save the government money. Because what happens? That motivation for them to save money, what does it do? It puts more money in their pockets.
Absolutely.
And that is the motivation. But we as citizens and as consumers, we have to know how to push back. And the appeals and the grievance process is what Medicare puts in place for you to get what you need done.
I think the piece on top of that is that you've got to have good providers. You can't settle for just any provider who's not going to advocate for you.
Absolutely.
And many people don't realize that they've got choice in this.
Yes. You can always change your primary doctor. I had to do that in my personal situation twice. Doctor was giving me poisons that were damaging my kidneys. I went and found another primary doctor, took me off of that medication. Allah bless my kidney function to come back up. So yes, ma'am, absolutely.
Yes.
Brothers and sisters, thank you, Dr. Gloria, for your questions. We have about a minute left. We have a question from the chat. Just curious about how long the appeal and grievance process usually takes. Is 2 days typical? Is the question.
Well, let me say this. That's my personal experience. I do not know for all experiences, but in that situation with my client, it was a 2-day turnaround.
Got it.
Quick question.
Brother Bashir, I
Yeah.
see two questions. I see Brother Bashir has a question or comment, and then we have a question from the Baha Center. Brother Bashir, jump in with your question. And
Very
then
quick, okay. You may have covered this, Ameer, but there may be situations where a Medicare Advantage plan or PPO would be best or fit a person's situation. And with Dr. Gloria on that, is any of those plans, let's say, outside of the area, so somebody like Sister Gloria, acupuncture and other areas of specialty outside of the medical norm, would those plans cover? Again, would people need a PPO? I know they could go to their own doctor if they have a doctor that they're currently seeing and would prefer that doctor. Go ahead.
Brother Bashir, many of the Medicare Advantage plan cover acupuncture and cover specialty procedures like that. But again, it's need-based and it's driven by your primary doctor. So you can't just walk into an acupuncturist and sit down and have the treatment. You're going to be out of pocket. You have to direct that service through your primary doctor and get a referral for it. Or even if you have a PPO plan, your primary doctor needs to sign off on the need for that in order for the plan to pay for it.
Thank you, Brother Ameer. Last question or comment from the Baha Center. Jump on in.
Somebody have a question?
Oh,
You may go ahead.
I'm sorry. I thought someone had a question.
No,
If I can add something, if that's okay. Brother Ameer, my understanding is that like acupuncture and other specialty services with Medicare Advantage programs, those services are often contained within a managed care practice, such as Gen Care or Oak Street. You know, because they often will provide those services, they are in-house, and so they're covered more readily. Whereas, you know, going with a PPO plan, it may be a little more challenging to get your physician to authorize and to find an actual provider to provide the services.
My short answer is not true.
No? Okay.
There's no way that those two organizations would be the only two providers for those procedures. That's just not true.
Not that the only two, but
no, ma'am. Even for the ease of it, it's not true.
Beautiful.
If you go through your primary care doctor, and it is a necessity, and that doctor refers you in necessity, you having severe pain in your body, and you need to have a chiropractic procedure, your doctor recommends that you're going to get it. You know, acupuncture is another situation. It has to be on a need-based referred by your primary doctor. And that can go, again, if you have a PPO network, you can go anywhere that participates in that network, even out of network, to get services done.
Beautiful. Beautiful.
Alhamdulillah.
Brother, you are a wealth of information, brother. I know when I get ready to put them papers out, man, you're gonna sit down and talk.
Alhamdulillah, brother. That is what I'm here to do, is inform. You know, I've had many of folk. Here's some, brother. There was a couple, and I'm gonna share this, and I'm gonna be short, Brother Lionel. But a couple came to me. They were seniors. I believe they were in their late 70s or 80s. They only had Medicare A and B and had a stack of bills up to the wazoo of the 20% because they needed to go get stuff done. Mm-hmm. And I'm saying to them, I said, do you have income over, $1,100 a month? And they said, no, we don't cover $1,100 a month together. I'm like, you need to go and apply for Medicaid right now. And that gentleman took the bus down with his wife and his information, and he got on Medicaid within a week, they sent him his letter that he was on Medicaid. Guess what? That stack of bills went away. Okay. Did I want to put them in a Medicare Advantage plan? No, because with Medicare covering everything nationally at 80%, and with Medicaid covering everything in state at 20%, and also providing them a drug plan, they didn't need a Medicare Advantage plan. They weren't interested in it. They just wanted to stop having those bills come. So I'm saying that to you, I'm not always advising to get an enrollment. I'm advising to make sure that these people, these beneficiaries out here that need it, are directed properly. And Dr. Yambalaj Muhammad said to me when I was a youngster, age 11, son, if you take care of the people, the money will come. And that's what I do. I take care of as many people as I can, and Allah will bless me beyond my expectation. Ameen.
Ameen. Well, I want to thank you.
Yes, we do.
Yeah, there's one other benefit. I'm gonna jump in there. You know, there's a hardship benefit too that is provided. You want to tell about the hardship benefit for people incomes?
The only benefit I know that's a hardship benefit, my brother, is Medicaid. Medicaid is provided by the state of Illinois when you have low income and you have a health situation. If your income is higher and you have a health situation that's breaking you down, you still can qualify for Medicaid. And financially, Medicare provides a low income subsidy to help those under a certain income threshold with the cost of their medications. Those are the two that I know about.
Yeah.
Anything else,
okay,
brother, is beyond my scope. If you want to inform the believers of something else, go right ahead.
Now that's what I was referring to. There's a benefit, yeah, that can help you pay for your prescriptions or hardship benefit. That, like you said, it might be through Medicaid. Yeah.
Yes, sir.
This is something we need to know, to be able to take advantage of those things. It helps our community too. When we're taking advantage of all of those things, then our community is in a much better situation, health-wise, financially wise, spiritual-wise, emotional-wise.
Mm-hmm. Well, let me share this. May I share this, Brother Lionel, before we move on?
Yes, sir.
For all the ears that are here, I do. In fact, that's what this is, basically a Medicare 101 with a question and answer period. I can do this same thing for other groups like Brother Imam at the Bahar Center or Brother Imam at the Taqwa Center. If you need me to do a Medicare 101 on perhaps a Saturday or a Sunday, let me know, and I can be in person to answer questions and to share and to hand out that cover sheet, because I use that for all my education events. And I do the same thing for at senior centers and group homes, things, wherever there is a gathering of senior citizens, I can get in front of them. I share this information and answer their questions. And in fact, there's a club membership. There's a club that I go to. I have an ongoing situation with them to come in once a month and share this same type of information. So I'm available. Utilize me as much as you can, and inshallah, I help folks understand their options better.
Yes.
And any question is there is no dumb question. Any question you have, I'll entertain and answer it. And if I can't answer it, I'll tell you I don't know it, or I can find the answer for you. Inshallah.
Inshallah. Well, thank you, Brother Ameer. May Allah accept this wonderful service that you provided for our communities today. I want to thank you for your time today. I want to thank the believers who participated in today's session, those who posed questions. Thank you for contributing to the conversation, because undoubtedly you posed a question that someone else was thinking. So thank you for that. I'm going to ask if Brother Imam Omar would like to offer a few words, as we have come together for Fourth Sunday, both Masjid Al-Taqwa as well as the Ephraim Bahar Center. If there are a few words you would like to share, Imam Omar, you have the floor right now, inshallah.
Okay, this is Imam Najib. He stepped away for a couple of minutes, so he asked me to, to make any comments. So we want to thank both of you brothers for all this. This is a wealth of information. Your knowledge is powerful, and I'm hoping that we be able to take some of this information back to our loved one and be able to share it with us. And if Imam to me, Ameer, Ameer Mohammed, is if he's available, we certainly like to contact you if we have any more questions.
Yes.
Thank you. May Allah continue your best, each and every one of us. Thank you very much. Well,
You're welcome. Thank you.
Thank you.
And ma'am, Tariq.
Thank you, Dr. Lionel, for your facilitation, and Brother Ameer for the information. And I want to just kind of double down on something that Brother Ameer mentioned, which is to let's do our best to share the information, or to get him in front of people so that he can share that information. I definitely appreciate the expertise. I'm 15 years off from being able to take advantage of these benefits.
Coming fast,
but
brothers, coming fast.
it is. But just thank you so much again for the presentation. And inshallah, I look forward to the next iteration of this. So, assalamu alaikum.
Alhamdulillah. Walaikum assalam.
Assalamu alaikum.
Well, thank you again, dear brothers and sisters, for your participation today. It's a beautiful day outside, and I don't want to keep you too much past 2 o'clock. It's now 2:11. I would like to call this Talem to a close, and we shall end, inshallah, with prayer. Walasa. Inna linsana lafi kusra. Ila ladina amanu wa amilu salihati. Watwasa bil haq, watwasa bis sabr. Ameen.
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 Thank you.